Health Talk Live with Liz, sponsored by TriHealth.
Hey, good afternoon once again. With the reopening of schools and businesses in the tri-state, there's some good news today. In Health Talk Live, we share the latest with the head of infectious diseases at TriHealth. His name is Dr. Stephen Blatt.
It seems like so far we've gotten through the Labor Day holiday without a big spike in new cases, which is different from after the 4th of July, where we had a big spike of cases in mid-July. So far, the R factor, which tells us how many new patients are getting infected for each current patient, is running between 0.9 and 1, so very flat epidemic curve right now. It's not accelerating, it's not really decreasing, but it's flat.
Okay, so one of the things that we have learned is that we're going to probably have to live with this. So you now have some patients in your hospital. Are they only in one area? Are they next to rooms? Do you know how to protect yourself? Tell me about that.
Yeah, so within our hospital, we have been still cohorting patients who have COVID, so keeping them in one unit. Now, once in a while, once they are through their period of infectiousness, we will move them to other parts of the hospital if they have special needs, perhaps that can be better treated in those parts of the hospital. But we're still trying to keep patients together who have COVID infection who might be infectious.
And one of the reasons I've heard that the death rate is down is that we're better at treating this than we were in the beginning. So what's different now?
Yeah, so we know a lot more about treatment of this disease. So we know that steroids help patients who need oxygen therapy, keep them off ventilators, keep them out of the intensive care unit. We have an antiviral medication now called remdesivir that will shorten the duration of the illness if you give it at the right time pretty early in the course when that patient gets admitted. And then we also have convalescent plasma. We're still not certain whether that is beneficial, but at least in some patients it does look like convalescent plasma can have a role and reduce the severity of the illness.
Okay, and then probably the vaccine is the hottest controversy out there right now. Do you know when we're going to have a vaccine, and how do we know that there's not going to be pressure from the government that it will just get out there and it won't be safe?
So the vaccine trials are enrolling now. We don't know when we're going to have data. It's possible we'll have some early data by the end of this year. The FDA has protocols in place to make sure that the vaccine is safe and does not get approved or released before we know it's at least safe. The effectiveness may take a little bit longer to actually enroll enough patients to prove exactly how effective the vaccines will be.
And are you comfortable as an infection control provider that if and when there is a vaccine that will have gone through all the same trial practices as any vaccine now that is on the market?
Well, this one's going faster, and so we may have what's called an emergency use authorization from the FDA, which will allow the vaccine to be released before we have the full data set available. And I think at that point we're going to have to make decisions as clinicians and health systems about whether we provide the vaccine or release it generally to the public.
So tell me what you're talking about. We'd love to hear from you. Coronavirus or anything health related on your mind. You can shoot me an email or hit me up on Facebook. Twitter address is @LBonis1.